Minister Young.
Thank you very much, Minister Cox, Minister Dial Singh, and Dr. Trotman, who I have a newfound respect and loving for. Good afternoon, members of the media, wider viewing and listening public of Trinidad and Tobago. It would be an understatement to say that globally, at this stage, we are in exceptional times. One only needs to look on at what is happening in Europe and right here in the Western Hemisphere with the United States on a blow-by-blow moment, minute-by-minute on some of our international news networks to see how this COVID-19 is affecting the globe. Yesterday, the Prime Minister gave a very comprehensive and contextual statement in the Parliament, and I'd ask that people, if you have access to it, go back and look at it because there were a number of serious messages therein. What I've come here today to say is understand that COVID-19, first and foremostly, is about your personal responsibility and your personal and social responsibility. And there is going to be inconvenience with how we operate whilst this virus is within our midst. We are asking that people do not take actions that will expose other members of the public to unnecessary risk. And it is amazing with what we've been dealing with, some of the instances, examples in the last 24 to 48 hours. Travel. The government came out on Thursday at our post-cabinet press conference and we urged persons to please restrict travel, and this is travel particularly via air and cruise ships, to absolutely essential travel and emergency travel. I cannot overemphasize that point today. We recognize that at this stage there are a lot of nationals trying to make their way back home, but persons need to understand the exposure and the risk factor associated right now with travel. So please do not travel unless absolutely necessary or it is emergency travel. The government have taken a decision, and I'll reiterate it, that the government funded or related travel is an stop. There is very little that will qualify for us right now that is essential travel. A lot of the instances and emergency circumstances I've had to be consulting with the Minister of Health and other foreign governments and medical experts over the last 24 hours are associated with air travel, persons in the CARICOM region, international travel. Right now, at this stage, and Dr. Trotman and Minister Dial Singh can correct me if I'm wrong, our cases are imported cases. There does not put a stop to the importation of cases. You saw President Trump a few hours ago when asked a question about the potential of banning domestic travel within the United States. He immediately said, yes, it is up for consideration. Shortly after, he indicated that the United States have now gone the full gambit and banned travel from the whole of Europe, including the United Kingdom. We in the government of Trinidad and Tobago are urging persons, please do not travel unless it is absolutely necessary, meaning an emergency. Right now, two of the areas that the CMO had pointed out to me before this press conference in our pre-meeting, two of the areas where this virus is circulating, and I'd add a third, very prevalently are in international airports and in resorts around the world. Added to that are cruise ships, right? Thankfully, cruise ships have taken, well, vast majority of them, decisions to cancel, but we still have persons contacting us, amazingly, from cruise ships where cases are presenting themselves. In the last 24 hours, I want to make the point, this government will do all that is necessary to protect the people of Trinidad and Tobago. I had two judgment calls to make in the last 24 hours as the Minister of National Security after consultation with the experts, where we basically prevented persons from getting on planes abroad to come to Trinidad and Tobago. In one instance, I also gave authorization for the blocking of a particular plane to come to Trinidad and Tobago. These are decisions that we will take as the Minister of National Security after consultation with who I need to. I will take these decisions to protect Trinidad and Tobago. But the message is personal responsibility. Another point I'd like to pick up coming out of what Dr. Trotman says, all persons returning to Trinidad and Tobago, we are asking you to put yourself in self-quarantine for at least 14 days. We are very aware that there are persons returning to Trinidad and Tobago, nationals, citizens, residents, who are returning from countries where COVID is prevalent. And this all ties back into the social responsibility point, avoiding gatherings, avoiding public places, because they have the right to come back. And we're asking these persons to please self-quarantine. So we have persons returning from Germany, persons returning from the United Kingdom, persons returning from other areas of Europe, even some places in the United States. Do not be irresponsible and go and put yourself amongst the public and in public spaces to present a risk to other persons. Self-quarantine, we are pressing for anyone returning to Trinidad and Tobago. Please self-quarantine yourself, as you heard Dr. Trotman say, for up to 14 days. For contact tracing, which we are doing quite a lot of right now, we are going to need certain information. So persons returning to Trinidad and Tobago, we're going to be asking you to provide that information. And then also persons who know that they're in certain circumstances where they're at risk, we are going to ask for the contact information. Persons should refrain from escalating concern. We are seeing, even being reported in some articles, persons speaking and escalating their own personal concerns that are going to have an effect on the rest of the population. As I said at the outset, there is going to be inconvenience to people. People who take decisions to self-isolate, to self-quarantine, it is going to be inconvenience. There is no need for you to be talking about how the state isn't contacting you. The state can't contact everyone. You would recognize at this stage it is all about prioritization of resources, and there are a lot of people that those resources need to be prioritized too, and our healthcare system is doing a tremendously great job. Social distancing is one of the points I wanted to emphasize. Social distancing meaning keeping that space between yourself and other people when you're out in public places, as you heard Dr. Trotman say, and I don't need to repeat, the touching of persons, the shaking of hands, all of these things have to change right now. Responsible reporting. I have been in constant contact with my colleagues, the Minister of Communication and the Minister of Health, throughout the course of the last 24 hours. It is obvious that there are a lot of people who are going to engage in irresponsible acts, and they're going to be using social media. In fact, I was informed that certain people are using it for political purposes. I think that's also obvious. I didn't need to be informed of it, but that is a fact. There are only two sources of official information that will flow for anything to do with COVID-19, the coronavirus, from the government of Trinidad and Tobago: the Ministry of Health and the Ministry of Communications. So use that as your testing. Unless it is from the Ministry of Health or the Ministry of Communications, there is no other official channel of communication of information. And as we've shown, we are going to be completely transparent in this process. There is nothing that we're hiding. So the irresponsible people that authored and crafted a message this morning pretending or holding out to be some medical person, some doctor in a lab, and sending this type of rubbish, please, members of the public, do not even worry to pass it on. Do not share it. These are not authentic pieces of information. There is nothing that is being done that the government is hiding. So the only official information will come from the Ministry of Health or the Ministry of Communication with the utmost transparency, with, of course, the proviso, as Dr. Trotman said, patient confidentiality. The testing is taking place and there's nothing for us to hide. Schools. A lot of questions at this stage are being asked about schools. This is a very fluid situation, as we said, and as the Prime Minister announced. We have stopped schools for the next week, but it continues to be assessed. We will continue to be guided by our medical experts and take into consideration other matters that we believe need to be taken into consideration, and make announcements at the necessary instances. From a national security point of view, we had We have been having meetings. We had another one yesterday where we invited the CMO, and we are prepared at National Security to do what needs to be done, including to arrest persons if necessary for the maintenance of public order. We had an incident at the Piarco airport earlier today, and we were prepared to do what needed to be done. And that goes to a point that Minister Dayal Singh made a short while ago. Please, people, when the authorities in Trinidad and Tobago ask you to do certain things, please listen. It is only for your own good. So in closing my part of the messaging, I just want to re-emphasize it is all about social and personal responsibility. Avoid the mass gatherings, avoid the public spaces. When you're in public spaces, social distancing, provide the information, and understand that the government will continue to act in a very responsible and proactive manner. And I end by saying, on the point of responsibility, the sharing of false information and disinformation, the only sources of authority who will speak to COVID-19 and the coronavirus via releases are the Ministry of Health and the Ministry of Communication. Thank you all very much.
Thank you, Mr. Young. Ladies and gentlemen, I would just like to acknowledge the presence of the Permanent Secretary, Mr. Asif Ali, and also the presence of Dr. Roshan Parasram, Chief Medical Officer, Dr. Marlon Rampal, Consultant Medicine and Infectious Diseases, North Central Regional Health Authority, who would also be here to answer questions. Before I field questions from the media persons present here, we just want to thank the sign language interpreters, Dr. Paulson Skerritt and Ms. Eka McPhee. Ladies and gentlemen, the floor is open. Please identify yourself and the media house first, please.
Drew Brown, TV6 News. Minister Young, could you give any more details on the incident that occurred at the airport you referred to?
What we had at the airport during the course of today is we were contacted that there were persons who were not listening to the authorities. They wanted to board a flight. The airline had taken a decision not to allow them to board the flight, and they basically did not want to listen to the airline and to listen to the authorities and to move on. Understand that if there's a risk of persons, as I said, the airports right now are risky, international airports. So if there are persons who have a risk profile, we don't want them out in public and this type of thing. Self-quarantine, as you heard Dr. Trotman say, if the medical experts think there's a need, they will quarantine you.
The person is quarantined or detained in a holding cell, or what is it?
No. The person was out in public and was not being allowed to board a flight, and then rather than go on self-quarantine, thought that they could just sit there and wait. So the person is now in quarantine.
Question to you, Minister Dayal Singh. The test